The oral microbiome is a critical factor of maintaining systemic health. Many studies have correlated the oral microbiome with metabolic diseases such as dental caries and periodontal diseases. A possible mechanism is an increase in fermentable carbohydrates in the oral cavity or saliva, establishing a favorable environment for pathogenic microbes. Oral microbiome can transfuse into the bloodstream through the gingival crevice and thus move throughout the body. Studies suggest that the oral microbiome can affect blood glucose levels, probably in this way, because high sugar levels, or hyperglycemia, in the oral cavity and saliva is usually the case in diabetes. Diabetes is the leading health issue in the US and other parts of the world. 1 in 10 Americans have diabetes. Some studies suggest that periodontal diseases is associated with diabetes. For example, periodontal pathogenic bacteria such as P. gingivalis and A. actinomycetemcomitans are directly linked to diabetes, and the genera Streptococci Lactobacilli belonging to the phylum Firmicutes are found more abundant in diabetic patients, and treatment of periodontal diseases can improve glycemic control in patients. However, direct evidence linking the oral microbiome with diabetes is lacking. Therefore, this mini-review of 3 papers is conducted to explore association between type 2 diabetes and oral dysbiosis. Paper 1. Association of the oral microbiome with the progression of impaired fasting glucose in a Chinese elderly population. Wang et al., 2019. Paper 2. Characterization of oral bacteriome dysbiosis in type 2 diabetic patients. Kori et al., 2020. And finally, association of oral microbiome with type 2 diabetes risk. Wang et al., 2017. By reviewing these 3 papers, we aim to evaluate differences between diabetic patients and healthy individuals in terms of their oral microbiome and thus identify bacteria that could potentially be hyperglycemia associated. Let me give you some background information. The first paper is a cross-sectional study based on elderly population of 150 subjects in Shanghai 2019. The second paper is a case control study on 104 individuals in Karachi, Pakistan in 2020. The third paper is another case control study on 294 individuals based in the US in 2017. First of all, according to the second paper, the alpha diversity, which is the variation of bacterial genera in the sample, is found less in diabetic patients compared to healthy individuals. This is because the environmental conditions in the oral cavity of a diabetic patient are stressed with hypermineralization and increased acid-producing and acid-liking microflora. Now, we'd like to identify some bacteria that are found significantly different in abundance between diabetic patients and healthy individuals from the first and third paper. In the third paper of our review, multiple taxa of actinobacteria are seen less in diabetics. All 5 families of actinobacteria, Actinomycetaceae, Bifidobacteriaceae, Corynebacteriaceae, Corynebacteriaceae, and Micrococcaceae, are less abundant in diabetics, and within those families, 6 out of 7 genera are less abundant in diabetics. Particularly, the genera Actinomyces and Atropobium are significantly associated with 66% and 72% decreased risk of diabetes. So from this study, actinobacteria is found to be associated with a decreased risk of diabetes. Proteobacteria, like genera Pseudomonas, Stenotrophomonas, and Campylobacter, are also found lower in diabetics. On the other hand, according to the 3 studies, some acid-producing bacteria are found more abundant in diabetics compared to healthy individuals. For example, phylum Firmicutes thrive in an environment with a high amount of salivary glucose. Firmicutes include genera like Veillonella, Streptococcus, and Staphylococcus. Their abundance is significantly higher in type 2 diabetes or hyperglycemic patients. Presence of genus Gamella is also associated with an increased risk of diabetes. Interestingly, in the second study, Gamella was found only in the saliva samples of female diabetics. Other acidogenic genera found in greater amount are Prevotella and Capnocytophaga in phylum Bacteroidetes and Leptotrichia in phylum Fusobacteria. Genus Bulladia from phylum Erysipelotrichidae and Catanea from Lactospiraceae are also significantly higher in hyperglycemic patients. In conclusion, the main hyperglycemia, or T2D, associated oral bacteria mentioned in the 3 studies are from phylum Actinobacteria, Proteobacteria, Firmicutes, Bacteroidetes, and Fusobacteria. Whether they be found greater or lesser in type 2 diabetes compared to healthy individuals. Furthermore, reduced alpha diversity of the oral microbiome is found associated with diabetic patients. It is not clear whether these variations found between patients and healthy individuals are the causes or the effects of type 2 diabetes, but these studies suggest that 1. Dysbiosis of the oral microbiota may be a typical feature of hyperglycemia and may aggravate the progression of hyperglycemia. And 2. These hyperglycemia-associated oral bacteria might be useful for future disease diagnosis, risk assessment, and treatment.